inaccurate information and rumors on COVID-19 vaccine is still spreading widely, and there are various questions and concerns around the safety and efficacy of this vaccine. Many people have lost their lives, either at home or on their way to hospital, even before being diagnosed. Therefore, today we will shed light on the fear, confusion, disbelief, and uncertainty towards COVID 19 and vaccination. And we hope that by the end of this program, all the eligible persons will proceed forward to get the vaccine within the time frame and no one will be left behind. Nisoy nga ba sa kantikon, ya programo na rin tsakswa, aro sa kantinan ya tamni nam gapa salam ko unching nagata ska. Ang nibiyamang Dr. Moami Marako nga, aro ya program ko, Meghalaya Solkarini, National Health Mission, taororo ta rakpi gabroro ingaba, coronavirus ni ungating gaba sabisi, COVID-19 gaman, talati unani ko dakna, aro ya sabisi na, tika shuani gamchatani ko iyat na, aro singenang porika ba test katna ribana nangani ko, uyate talati unagata ungatinga. Atingnya adoko, chunga kita COVID-19 ni tika dongoba. Baka mandirangan, tika ko rana jaja kuinga. Bara na skuja, aron noko, sai dunggen chimoba, singgenang test, ba porika ko rana rebaja. Chingni knani, aro masyani kitari, iyarang plakan, kapket ko masyi chinggija, to le jangbang bangga baka tarang ko, beber ay, jaja nirang ko maninga. Yanya selan baka mandirang noko bara mao hospital na sukmas kangan jangi gana na sukaha. Uni gemen da ni programo chinga tentang manca ya covid sabisini gemen aro tika shwani bidingo taldapati unanirang ko dakanggen. Aro chinga kadunga ya program ko nikswani jamano plak jajani aro kenanirang na akan cakani ko matgen aro tole jang bengbang kepa khatarang ko bebe ragija besi chiung kepa mandirang COVID-19 tika ko nagata reba token je dakode saksaba tika shujaba mande dongjawa. Dalo chung baksa nam begepa doktorang tenang aro uamang chini singanirang na agan chake tagatani ko unanggen. With us today, we have panel of expert doctors who will be answering to our questions and help us clarify doubts. First of all, I welcome Dr. Kalkambe Sangma. She is a dermatologist working in Civil Hospital Shillong, and she has been working actively in the COVID ward since the pandemic hit our state in the year 2020. We are also delighted to have in our midst Dr. Victoria Moman. She is a senior medical and health officer in RP Chess Hospital, Shillong. And we are also fortunate to be joined by Dr. Alka Flora Marak. She is a medical specialist in Ganesha's MCH Hospital, Shillong. Thank you for joining me in the program, doctors. And without any further delay, let me start with the questions. I will be asking in Garo, and the same question will be repeated in English for the benefit of all our viewers. We will also be taking live questions from our audience. And tao jol anga singanirang ko takangin skang tao anga Dr. Alka Flora Marakos nagta skinga. Dr. Marak, may gaman mandirang ya COVID-19 ba coronavirus na test ba porika ko rai niya ni ko dakna ng chumota. Aro, sawarang ya porika ko ra na nga, aro ya ko dakani chi may kaya pandemic ba sa jinma patdrikani ko ding tangat na kita magyen. Yani bidingon ani so nga parang na kantaki tagatani ko dakna magyen ma.
Mutala Dr. Marak. Ya COVID sabisi ko anjing dauro 느끼게 gepro harak ke gepro pa sabisi mangsa sajin mas sagop jiko nanching pandemic ne ganawa uinga mo to ya sabisi na anjing maina test kan nga maina singinang test kan nga maina anjing sabisi ko matno how ba ya sabisi ni chin na ko miso kuja antang ko sabisi antang ko saja ni chanchi mangna test kageja donga ngode ya anda ka ba mandirangan je mangan sabisini chinna ko misok khujanga chim yamang gapen mandirangan sakpen no na batat altui batat na wamang masigija Sini salang ti dongrum roromaniyo saksa sakapun na batatani ko matna. Aro anching genang test ka imong na ba alam la suspicion ba sa antang tangko sa dunga ini suspect ka imong na test kaon yara maiko dakcha kana yara anching early identification ba ya sabishi ko genang rum soy mama ne mong na soy mong na ya sabishi na sana banani ko nung na matgen endaki mong na ya mandian jian ya sabishi ko rasongri matna hachim wa mandini contact ko dong parang baje mangan wani se pango protection gri ba ya mask kan gija jakshwani ko jakhal gija shethang ke dongi mungna samsakani ko jakhal gija dongman hachim yarang ko wa man ko ching track kai mungna ba sandi mungna wa man ko sagija upparangani ko mai katte doni mungna ye sabishi ko batrorwani ko jela batrorwani ko ching jumping sona gita mana aro ya anchini India sorkari ni mungbonga mungsongbat kepa jakudi adiba five-fold strategy oba mungsongbat kepa bakong geo nanjing testing ko neka tracking ko neka treating vaccination aro covid appropriate testing na siya antana ko test kaani tracking de je manderangan ya sagba manderang mang contact donga hachim ba dongrum rorum hachim wamang ko anching sandi mangna ya gapro rwani ko jumping na matgen ba transmission ko break kana matgen aro yamangko namgapa sana bananim ko singgenang nem na wamangko namgija batpa gadongana sokaka anchin hamping na matgen aro yan baksa vaccination ba tika shu ani je rangan ta besi chung hachim je manganya tika ko ra na matna chem wamang vaccination ko rai mangna aro covid appropriate behaviors je kai mask kanani saksa sakabani chethang rke dongani hand hygiene ba jakshu jrungani sabun chichi yongbo alcohol sanitizer chi yongbo aro ancheng ongkhat tahon mask double masking khani aro saksa aro unki gathering ban ke jinma program rong ongat parang ko dakki jani yarang chi ancheng meba sabishi baturani ko donthongat na matna aro sawarang yako test khana matna yako jokon je mangan skang pade je mangan ye sabishi sagop ni chin rakom esok ya chim je kai ben shuan ben pretani ba fever je kona kana ching je mangan ben sadikinga ben jumingan ko je kona ching jakhalamun normal nomenclature nakimnos ko sadikani ba gushu ani adak nang badak tunggija basak wada chim mukun gachakani ko niken basak wada gengteng changketani ba tuani ko masigijani bibarang ko masigijani aro nangana batin nikngani mamung kamko ndakte dakujengin chimno bawa nikngani je nanchingni beno nyokate wako anching mashani aro ultimately rangsi sokkijani yarang je mangan dakaba size namsan dongachim aro je mangan dauroni getal variant de okriani ba diarrhea je ko nakana mo wa dakiba misok niya so dakaparang dongkin chimode antan tango singinang test kana nga antan tango voluntary tangan kangira ay mga chakchigi jan antan tango test kana nga yana agriba je mangan science symptoms ba chin misok kujay nga chim indio mangwo wamang covid positive patient mang contact donga hachim precaution gri ndakba mandirang antan tango test kana nang chongota antan tango sepang batko health center ne yang na test kana nga ndaki mang je mangan biap damsano sori sagop matninga chimjinma test khakuja dakmo sori sagop matninga chim dakaba biap nyong genchi moba yang phachina molatinga aro je mangan apalchi india ni apalchi ba india bo ongjamena je rangon covid belonging achim covid jeling achim dakaba biap rangoni maiba kamna porena songri banginchi modi yamang nakaba mandirang ba test kana nongchung mota aro mungsong batte je mangan vaccine ko rakhu jenga chim ndakpa mandira antan ko test kana nang chungmuta aro ya antan ko kangira nananga yarangko aro ya test khani chi ya ndakple widespread testing khani chi bagmukko test khani chi screen khani ching maiko manna muksonga ya testingan ya sabishi ko china amna gtadis khangpa kiyo ngamaina anching testing ka esa sawa sajenga ko mashi mungna sagaba mandiko maikate doni mungna batrorwani ko jelrwani ko anching something sona mana aro yamang ko singenang anching mamangin chimno de singenang jakhu diani rangko dakna mangin sana banani ko na mangin wamang namgija pa gadang wana sokwangja china anching sansona matgen aro yarang baksa vaccine shu ani ka chung jakhalgen chim mode anching ye sabishi sagopni jelro ani ko champing na machung motgen aro expert rangni agana kha anching na ong ode tika shu ani ya asong damsa o percent sochet ba 80% batahan ode ya sabishira anching ko ndak play problem ngat jo haba ya anching ko ndak play effect kha jo ha nigman ya vaccination de nangchung mut ko nga along with early screening and early testing
Matera Dr. Alka nambe thalatani na dao jol nga Dr. Kalkambe e sangmako gupen question ko ask kana tas kinga Dr. Sangma na ni swing pa rangna thalat na matgen ma mai ni gaman acheng COVID-19 ni Chicago shutna gata nangchung mota menggepenaras anirang baka mandirang o ya tikani side effects baja dring anirang dunga aro je mangan COVID-19 sabishiko manachem ba namplachem wa mangde ya tikako rana gata nangjane yani bidingon out chitis latna gata matgen ba
Betul lah Dr. Mohamad, biasa Anina. Ya COVID tika shuanira namen nang sumat kepa maina anjing ya bersio COVID habis ini keproro ba jelro ani ko dipna gata maninga aro baka mandirangan je mangan je cadam berang jirangan belaka wasa pamamung sanirang dongja wanda keparang ni belong ni sanirang ko maknani ko aro mandirang ni sianirang ko ba anjing ya bersio dipna gata maknaha aro maninga ndaki ngingon anjing cikarang ko suani cisa yang ko camping sona gata yang nambat kepa cholonga tau ya cika suani ra anjing ko mai dake dakchaka skang kepa o anjing cika suani ra anjing ni covid sabisi ko matnengani na chui matnengani ko komiata aro genik pa o yang gen chimo ode anjing covid-19 ba covid isku sabisi ko matne blonge saniko manani aro shauna sokawniko champing sona ba yara ba champing sona ba komiat na gata dakchaka aro gtham kpa o anjing sia tikarang ko sugen chimo ode sabi sini geprorwani ko anjing champing sona aro ndakke anjing nuksu sumsuni mandirang ko ya sako manawni ko naljokat na gata ba dakchaken daw anjing banga mandirang ni ya chika shuani side effect rangna khenani ba jajringani rangko anjing khna sona gata manna ndi ba angan dake yako thalata gata skinga ya vaccine ara namen safe ngapa jen naljokpa aba aro effective ngba mo ba kham khagpa vaccine wa ni gemet anjing mamu dake bena jajringna gata nangja aro side effect rangara blonggen komia ba belongja ba maike akan get mile sangaya aro duksa salang nasan dungaya dakemang ya side effect rang jekai jeng BN denga BN niknga aro matam rang de biji sugpa biapo sadekani rang aro waneke matam mandirang de dike BN ni nikani rang ko makna diba ya rang ara duksa nasan ungaya Uni man ya rangna jajring na gata jeng nangja aro cikarang ko na simang mamu nekani grian shuna gata mangen dake mangna anjeng matam rang de sungani rang dunga mo je kai covid mangen chumhang ode wamang ya cikarang ko shuna gata nangja wa dake chansia ndi ba ya nangan dake akan gata ska je mangan covid saniko manne nampla hacheng wamang ba ya cikako shuna gata nangchong mata maina baditana nangni wara chakani ba immunity power mo donga anjing masija ini kemen ya cikarang ko shuani chira ya sabisi ko manthaina gata ba manna ya aro ya ho manthai gen chimo ba niba na chika shugamen gen chimo ode ya blonge sani ko aro shauni ko champing na gata dakchaka aro anjing da oro de nikna gata maninga gatal rokomni virus ba new variants mo ungkatani rang ko anjing kna sona gata maninga aro matam rang de blongen saniko atna gata matna ya bersidi ancing bangin dike belongis hani rang koba nikaha aro mandirangi janggirang ba bangin gemaha yarang ko ancing wara chaksona de ancing antang tangko aro banga ya mandirang ko ancing chika su ani chisa yarang ko wara chaksona gita matgen ini kemenang bon kami daki akan kita ska chika su ani rang ancing sakpan chini daitu ba jutiong chongmota ancing ni kami ancing antang tangko sana ungja di ba ancing ni community ko ya sabisyo ni ko daljoke rakina ba wara chaksona gita chela.
Thank you, Dr. Sangma. But for the benefit of the viewers, I would want to ask you this in English also. Can you tell the audience why vaccination against COVID-19 is important? Can you please summarize on that?
Okay. Yeah, I've been telling it, Garo. We all know that this year the virus is spreading very quickly and it is affecting very even the young and the healthy people. So we really need to act fast to tackle this COVID-19 infection. And the best thing that we can do to protect ourselves, our families, and our community is to get ourselves vaccinated. Now, why do we need to get vaccinated? Now, number one, this vaccination can significantly reduce the risk of getting infected with COVID. And secondly, it can help prevent death or severe infection, even if one gets COVID infection. And thirdly, to reduce the spread of virus and help protect our family and the community. Now, most of the people are scared of the vaccine side effects, but we must understand that the vaccine is safe and effective. And the side effects from the vaccine are mild and they last only for a few days. Now, the common side effects are fever, pain at the injection site, then fatigue or body ache, which these side effects such as, and some side effects such as fever are the signs that your immune system is fighting the vaccine. So it means that your immune system is working. So again, there are people who think that their natural immunity is strong enough to fight the virus and the infection. And people who have been infected with COVID, with the virus before, they do not need to get vaccinated. But now I would like to say or stress on that you should get vaccinated even if you have been infected by the virus or you have got infected with the COVID-19 because even for a few reasons. So the number one is like we can't predict who will or will not get the severe infection. And in fact, now as I have said, that many young people and healthy people without any underlying disease also, they have got severely affected by COVID-19. And we have seen so many people losing their lives. And even if you have COVID before, you can get reinfected. And then thirdly, there are new variants of the virus are emerging, and some of which can be very, very infectious. And so we can stop this by only getting ourselves vaccinated as soon as possible. And lastly, I would like to say that we all have a moral duty to get vaccinated for our community. Thank you.
Thank you, Dr. Sangma. Now we're going to take a short break and please listen to the health message.
Ôi nặng pha Ngadi am jing juk mi jalanin bi nan dak plan sing jinga aro bi en ban dak planning inga
mai wa
ngadi bi en ding skinga aro sul di gu shumat ninga angko check up ka in yu nam kin khun
de chala ina ba check up kana na ma yara bulshi antin shordi gusude dong chmaya ba wa chi khari shok joko de check up kana nang jamija nin na manga igen
na adi ya khata ko aga nan sal tham pleng jok te 아유, 아리네 인족 주시네 있구나.
어이 낭마, 어야 미치게 마야 옹족. 어이 낭마, 어이, 뭐야?
낭마, 우리 호스피탈 오나마이 놓고, 어디 암쟁주. 그거는 엉나 산이 남발도 나고파 동아, 사브리브리 사지로.
바로.
왕니 뵙고.
Halo? Angi dak wala gada nasima dak panabe. Narani gusuode, ben dengode, o kriode, nengokode, swe toa togi jako 마시자오데. 경퉁 마몽 비바코 맘자오데. 랑산 안탕코 사크버노니 젤리동앗보. 아로 코비드 19코 테스카이니보. 놓고 동호 마이바. 로콤그니 닥부아 막스코 간롱보.
National Health Mission, Government of Meghalaya.
Daw Jojo langa Dr. Victoria Momen ko skang skana kata skenga. Dr. Momen atno tunggu pamit marang ba je mangan oko kena chanchi samso ingachem aro bisana so bacho ko kaning pa magbarang ara tikako rana kita managin ma. Aro menggepanara COVID ni tikana sabat baat kija ni geban ba bagi jangkung banganirang donga. Na yani gemen nisu parang na agan pateni ko dakana magena.
Matela Dr. Moarimara. Good evening, everyone. Yan ambipa tamis halo anga kemuk niswenga ba sakantina yan ambipa salam ko unas chinga. COVID-19 tika ko shuanyo kamakena nirang aru iseta nirang ni aselsa endaki mandirang na jajata nirang sukpainga. Uni gemen yani gemen nambate aru talbate sakantikon seng sandina geta anga nasima sakantikon didinaska. Ye COVID-19 tika shuanichi darang mandina miaba mechek ongchong infertile ba bisha mana geta champingani donggen ne jangbangbanganirang ongchong motja maina yana mameng scientific sakhi dongja batisa ye tika ko shuaniara asel nangauniko jeltakswa geta sawa maina ye tika ko name sandi aru nye dakani ba scientific research ba testing genangsa thariaha. Uni gemen ye tika ko shuanyo mameng jajingani gri plakan shuna mangen. Government of India ye tika ko shuna gata begenange aru namneke bisana sokhanengpa maana aru nidena mameng dakeba kenani aru jajringani dongna nangja ni wiataha. Maina ya COVID-19 tika ko shuanyo maa aru dena kenani dongani mameng scientific sakhi dongja. Bisarangko dengtang mancha sangapa doktorang ba ancheng English si pediatrician ya gana wamangni aganani getade ya COVID-19 tika ko maana shuanyo bisana aru bisana batisa ya sauniko chelchaksona geta ba immunity ko bariatna getasa unga uni gemen sokhanengpa magaparang mamung jadringagri ye tika ko shuna mangen anno dongpa magaparang na ya covid tika ko shuani bidingo chunga geta sandianirang dongkujachem uni gemen anchingni Meghalaya Sarkar ye Government of India ba India Sarkar ya tika ko anno dongpa magaparang na unku jengachem ndiba July ni gindi tariko Ministry of Health and Family Welfare Government of India ya tika ko anno dongpa magaparang na shuna gata manaigen ne agan thalatani ko ba didiatani ko naha ya tika ko rao magaparang na namgni bangbatani gemen India anno dongpa magaparang naba mameng ningkani ko rabajoa ne batesa ye tika ko suchina anno dongpa michkrang na ye COVID-19 oniko chelchakswa gata ungen ne wamang parakha anno dongpa magaparang ya COVID sabisiko mangen semode haida balzme sako manaba genachum ba okko dongengpa bichana kengenirang ba namgija wanirang dongnaba gedonga uni gemen sakhirang ko mane aru chunga geta sengsandiani ko dakani jamano indiani sorkari magaparang na ya COVID tika ko shuna gata manaigen ini thalati unaha. Angni abachingo aganani gata maaso khanengapa aroji mangan bisha dongna skingachim aro nuktang baku dakna mingatim aro anno dunggapa magaparang wamang sakkan tian jajring bija ya tika ko na shuna mangen matela.
Okay, Matella, Dr. Momin. What I was asking Dr. Momin is that there are a lot of concern among women on infertility and COVID-19 vaccine. So, and also they are concerned about the vaccination being safe for the pregnant women and breastfeeding mothers. So, Dr. Momin, can you please tell our audience about this?
These are just rumors of misconceptions. There is no scientific evidence to suggest that COVID-19 vaccination causes infertility, either in both men or in women. The vaccines have been found to be safe and effective because these vaccines have gone through rigorous scientific testing and research. In fact, the government of India has given its approval to administer this COVID-19 vaccine to all breastfeeding women who wish to take the dose. Most of the pediatricians have said that it may be even beneficial for the baby by building relative immunity to the child. Earlier, pregnant women were not recommended to take the COVID vaccine because we do not know what the effects of the vaccine would have been on the pregnant mother and the child. A national consultation on the matter was held in June, involving the representation of the state government, medical colleges, FOXI, NGOs, and other partners, and they unanimously welcomed the recommendations of the National Technology Advisory Group on Immunization to vaccinate pregnant women on COVID-19. And on July 2nd, the Ministry of Health and Family Welfare and the Government of India have recommended this vaccine that they can vaccinate pregnant women. First of all, I would like to say or state why this COVID vaccine is being recommended for pregnant women. Most pregnant women will be asymptomatic at first or may have a mild disease, but their health may deteriorate rapidly, and that may affect a fetus or the unborn child. Therefore, it is important that a pregnant woman takes all the precautionary measures like wearing a mask, maintaining social distancing, washing her hands regularly, and along with the necessary COVID vaccine. Therefore, I would like to recommend all the pregnant women to kindly consider taking the COVID vaccine. And as I've mentioned at the beginning, the COVID-19 vaccine does not affect fertility for a woman to get pregnant, or any breastfeeding woman, or a woman who intends to start a family, or a pregnant woman. So all these groups can safely take the vaccine. Thank you.
Thank you, Dr. Momin. It is indeed a great news that now the vaccine is safe even for the pregnant women. Now we'll be having a live caller. So can we have the live caller, please?
Hello.
Hello.
Sakandi doktor nan aptanam aro telaya sumakon anina Dr. Momiko. Dike ango pamungsa skani kusnak taskinga ango vaccination kuro anak taskinga ndi bango sya adita jajanira nongia menanga hazagni snio stroke ngaha aro stroke ani tamonode anga medication nongia aro dike dao anga samungtang ko jakalinga awa samrang aro ungjo New Hand Nakan bani Levi Grace aro EcoSprint 75 ko anga daw samko jakhalani ko takinga. Nengunia samko jakhalingon angara vaccination nakta managen ma. Kasapay anga thalat nakta managen ma matela.
Matela, Eliza Sangma, dao nangis ngani ko anga agan Dr. Alka Flora Marako agan chakatude nang begin.
Good evening, Liza. Nani na nako metela. So, ang niya kan sa kanila yan na stroke man jok chim una na sam ringing achim. Ya kat na ade wa category ga ka je mangan ya ko ra na nang chungmuta aru ma chungmuta. Mina je mangan sabi chi dong chapa chi momang na de vaccine shuanian am jaman jaun na asumna protection ga taung gen. Aru je samrang ko na daw jakhaling achim mo je rang ko na khna rukto. Warang mamung kita nak ni vaksin nang interference nung jah. Nak ni vaksin shuani na mamung kita ba nam gijani ko ba judging ani ko rak pacawa. Ni men ma judging gije vaksin ko ani sepang wat ba center ya ni shu epa.
Mutela.
Eliza Sangma, nang ni sengali nang nagan sa kaniko matahan yang kadunga, daawan cina harus saksa phone kain kepadunga, upan cing jojol, agat sa kang nabini sengali yang. Can we have another live caller?
Hello.
Hello, Mr. A.M.
Yeah.
Sarkar.
Hello, doctor.
Hello.
Hello.
Yes, hello, A.M. Sarkar. We can hear you.
Yeah, the volume is very low. Okay. So my name is Mr. A.M. Sarkar. I am a paramedical staff here in Shillong, District Medical and Health Office. So, madam, regarding the vaccine, one of my cousin brother, he in the past he had gone for angioplasty, heart angioplasty. So will he be safe if he takes the vaccine?
Thank you, Dr. Sarkar, for that very good question. And I would ask our medical specialist, Dr. Alka Sangma, Marak, to again answer to his question.
Good evening, Mr. Sarkar. Yeah, in regards to your question, your cousin who has undergone angioplasty, he is in fact a perfect candidate for the vaccine because he has comorbidities, and the vaccine does not interfere with any of his angioplasty medications. In fact, it will do him more good than harm. So I would recommend you give him the vaccine at the earliest, because people with comorbidities are the ones who are to be taking the vaccine as soon as possible. I hope that answers your question.
Okay,
I hope
thank you.
Dr. Sarkar, you have found your answers. Thank you, Dr. Alka, for answering to his queries. And now, while we are waiting for questions from our viewers, I think we can take on some questions which were asked in the previous sessions but could not be answered due to lack of time. I would want to ask Dr. Kalkambe Sangma that can people with food and medicine allergies take a COVID vaccine? Dr. Sangma?
Yes, those who are allergic to food or medicine can also take the vaccine. Now, most of the people who have these allergies are mostly the skin allergy. Then some people, they have a food or for the pollens or even some environmental allergies. Now, we have to understand that these allergic reactions are of two types. One is mild and the other one is a severe allergic reaction. Now, when we say mild, we will have some itchy red spots on our skin, which will go after some time. Now, severe reactions is when you experience, sudden breathlessness, and some people, they can have swelling on the mouth or the tongue, and suddenly they will feel breathless, and there will be sudden drop in the blood pressure. Now, again, these mild allergic reactions can have a acute. That meaning they can have allergy at that present moment, which lasts for few days. And the chronic allergy means which are for lasting for a long time or having for a long duration. Now, if you have an acute allergy at the time of your vaccination, I would say that you can defer your vaccination till you recover after after taking your medicines and getting recovered. And if you have chronic allergy, as I said, if you are having for a long time, and at the time of your taking vaccine, you don't have any signs or symptoms of your allergy, then you can go ahead and take the vaccine. Now, if you have a history of severe allergic reaction in the past, still you can take the vaccine because you may not get the same reaction to the vaccine. And so far, the vaccine is safe and there's no adverse effects have been reported. So, however, for those who are having severe allergic reaction and for even for others also, we encourage those who are vaccinated to remain in the vaccination site for 30 minutes for observation. Thank you.
But thank you, Dr. Sangba. We are having another live call on the show, so we will get to that.
Hello? Ya, saya ingin saya. Saya Dr. Victoria Moment tak umum salah tahan. Sebab mak gebarang pa tak uji vaksin nak nama nahan yang ini. Jadi mungkin clarification kita sangat mak gebar pregnancy nak ni high risk pregnancy umode. Unura ya kahush nama genma aro mak gebar comorbidities tunga ka ko de dong chapu de aro high risk pregnancy ode unura ya kachi shwani chi mamang ba side effect duang jama ko sa naknya patela
Matela, Mrs. A. Sangma, nang isang anina, aro nga Dr. Victoria Moment ko, request ka ate nga, yan nang isang anina, akan sakanin ko, o nang nagta.
Atamnam Mrs. A. Sangma, nang isang anina Matela, nang ni agaran ni kita de, ya high risk patient nara, high blood pressure ko muksong yama?
diabetic high blood pressure aro my first trimester aro my ya high risk my pregnancy bed rest to dona kana.
Okay. Ya pregnancy na shuna gata government ni agana ni gata de actually English ni agana gata de ya may macam tau study ungkweng amo mijal mangmangsa bisong approval unaha mijal 2 July usa approval unaha andi ba je mandirangan ba je maan high risk ungacham wa na shuna gata shu nambatken ani ya chini government ya daiko naha na clear ngaya hama ma
Dr. Alka nak ba yako titi talat na mangin ma Mrs. A. Sangmani sang anina? Mrs. A. Sangman akan na nga ba? Dr. Alka?
Hello, Mrs. A. Sangma. Is she still online?
I'm still live.
Yes, she's still online.
Yes, gani ko akan sak na kita. Actually, yeah, vaccine benefits outweigh the risks. No, saksa pregnant lady ko anchi chanchi bo. Ano nung ba mago po saksa anching immune compromise na chanchi naman gen. Mo, jean aro andaka situation no. Biya COVID pa mandap na nanga de vaccination gree without any protection. Uno de bina wa pregnant lady na wa ano dong ba magapa na risks batinga. Unigimen ya vaccine ko rana nangaw nagakni. It is important that she takes the vaccine because with the comorbidities, she is in risk of having a more severe infection. If at all she gets the disease. May ba takirasong greni si bewas ya sabi si ko man na ya bini sabi si gemek ni ko sa ko ya ko man dap na nanggin chimno de. Ya ano nung ba magapana ken na nang bat sangan yung gen. Unigimen sepang bat ko health center ni ang chengi mang na uni doktor ko grong cheng naman gen daud tong kueng nga de. Hindi ba daud kriyan mamang jajengan ni kriyan shoot na de man na de nanga aro nanga ba nang chung mota Menaya wa ano dong pa magupana namgini ko san rabagen namgi jani khode raban gepa sakhi dong kuja ba test wamao khagepa rango mamang side effects dongna nanga khude dongan gepa de dongja ini ba na mano nambata ini ba doubts dong khuing en chimlode antani sepang bat doktor ni ayamengna antani situation ko explain ka ayamengna ya vaccine ko rana matgen ini ba rana matno de nambata mena risk na batte benefits bata. I hope that answers the question.
Mitela, Dr. Alka, nambe talatanina, anga bibira, biya nis anirangna, agan chakaniko matahani. Tahu ancing tiktiksa break ko rangna, uni jamano jol ancing mandirang nis anirangna, agan chakangkugen.
Janggini rama ng ijakon Namgija sabi siko cecak naba ng ijakon Jak susrung mas ko ganirong talantale Jan mauro gijan tang duding tang samsake Ongija koborang kuk najana tika ko suwe haywara chakna Corona jat pasija kangal cha asiata Donga somoy cheyani dam sanja kudia chikenagri kanalna Kanalna, kanalna, kanalna kenagri kanalna Kanalna, kanalna, kanalna for better tomorrow Tomorrow, tomorrow, tomorrow for better tomorrow Tomorrow, tomorrow, tomorrow kumong'e talat mo, talat mo, talat mo, talat mo, unat mo.
National Health Mission, Government of Meghalaya.
Welcome back. Now we will be taking questions from our audience. We have with us Mr. Simon George, and he wants to know, Dr. Alka, double mask kanemang COVID positive ungba mande ko grumna manoda na jokani dongama. Any bias atingan.
Thank you, Mr. Simon George, marakoni question na. Double mask mama ungija. Double mask ko ni kungsade N95 okna nanggen. Aro na agrong na anggen chimnova. At least 6 feet chelaw ni bauna bate chelaw ni wa mandi menggulpo khana de matgen. Hindi ba wa mangni si pangchi ang na manje wa mangko dang tap na manje wa chelaw ni golpo khay mangna aro maximum 15 minutes, but less than 15 minutes exposure ang ato nambatken. Aro as soon as naawa biyapo ni yung katanga ha, you can ji ancing COVID appropriate behavior ancing hand hygiene doa bamo sabun cici jakshu ani ba alcohol sanitizer jakhalani ayang ko jakken chim no the risk humia. Enda ko mangba I would rather angi agan ako ra gen chim mode wamang ko salchikang tom nokpo ning takno chingi mangna salchikang jamno wamang ko gunay ango nambatken ngupa ko nga akan gen. I hope that answers your question, Mr. Simon.
COVID sagabako grunga yangin chimode chelaw ni grungon nambatken mas rangko namme gani mangna Dr. Alkani aganagaman kita chelaw ni ba open space so grunga ode mabunggo jawa ni ba na song distance ko namen maintain kana data nanggen. Aro dawat chingna saksa viewers natinga Salina Mara. Doctor, bein o aro skin rango allergic donga aro pressure sugar da kabarang dungora sikta shuna manggen ma manja unti sa thalato de mitha begin. Doctor kalkam sangman ayani gaman nagan sakat manggen ma
pressure sugar da kabarang dungora beinin o allergic donga parang aga dashi ko English chiba ganata ha daw ko garochi namme aganatna aganatte kangpao ya allergic mo ya allergic kara anchini allergic reaction ara banga changon skin allergy khakhtani rang batamo aro matam lang de maina kana anchini full bibalang ni pollens barang na allergy gokna batamana sau barang de haida samrang ni asel skin no sa khat ken allergic de ba samrang ni asel ba na dengkang environment ni ba cement bawa di chemical dengkang orang na ba energy ko nang ta mana ya. Tahu dia energy kara dia kini rokum benang sara mild form ba belong gica kepa aru biasa di severe ko ba je ko nan ke jumri belong ba severe allergic reaction. Inosa yang dia pangcaken mo. Uni gemen matam rang jekai belong gica ba mild reaction allergic reaction yang de na be eno khak kete diktik sana san orang de liba dungai gen liba khak kete gecak tak ke parang dunga mo. Indi ba jen salu cunga severe allergy reaction ya kana uno de na kucerang boa ba getok rang raw ba boeng na arang snarang manjawa arawan ke suddenly nang ni high blood pressure rang ba thakona ba ganang ko de severe allergic reaction ba allergic reaction mo. Uni gemen na nang ni allergic kara severe upama mild upama kuna wichina nanggen mo. Aro ya nak keparang ba na da sianga English chiba ko na akan ha na yang ko vaccine alas kang yang ko machine agta nanggen ara severe reaction ma nang ni ma ba allergic problem ra mild. Aro gesa rung thaya mild nonggen chumo ba na ara nang ni allergic kara na ara acute phase ma je ko nagan gen chumo de dao na dao gata somoy na allergic ko nga wa ko ba wada dipiksa somoy rang nasan ode tumaya wanda ko ba allergy ba uta besirang na ay allergic problem ba nga gisap reception na man na yan ako ba problem mo kon chronic allergic reaction mo chronic allergic problem dao de acute allergy na dao gens mo nga ode no de na vaccine shuani ko na diptiksana tontong tingnan tananggen aro na warang na nang allergic problem na samrang ko ay na mat tani jamano namplani jamano na mamung jajeng ani gri vaccine ako shunagta manaigen. Aru ya chronic ko parang je mangan utarang na ya allergic rang ngi achim warang de shunagta managen mamung jajeng ani dongja ande ke mang je mangan batang men somoy rang ba past history severe allergic reaction donggen chumo mangba wamangba ya vaccine ko shunagta manaya maina ya vaccine ara safe ma aru daut pete nike adverse reaction rang ko anchang krana man kuja aru dong kuja uni gemen ai rang ko shunagta manaya. Hindi ba mangsara ujok na ya vaccine ko raingon na minute kola China observation dongna kita nanggen maina bangpata severe allergic reaction rangan within 30 minutes so batamu kola minute kola China kemensa bisa ko ngong bata uni kemensa dawan sing vaccine chueng ba na simangko minute kola China observation doninga aro ya nakaba vaccine center ora sing doktorang donga na song dia China biologic problem donggen chumomba ya ko handle kana sing doktorang donga nurses rang donga uni kemen langsung mamung jajinga negeri ya vaksin ako shuna gata rana gata malagen aro mengsara bini singani da sugar dongo shuna matgen mane menamo ta si anjing ko ya medical specialist akan atahan sugar problem donga ode you are the right candidate uni kemen na shuna gata malagen mana ya sugar de yang ni comorbidity song yani mana chomot na nga aro yan nani yan first priority ko rai shuna nang gata matgen metela chanche clear waya hakon
aro success Francois marak andakis ngatinga Dr. Alka Flora marak ni agan nagata sai nam COVID check kagi jan namayen hindi ba mandi an tangko belakat na nang ska nakni agan nagata sai mong nampul COVID check kagi jan namay de hindi ba antang ko belakat na nang ska bini question ko bangi mashi jenga nami rongta jani kemen Dr. Alka na mashi nga bini siat ako ang kita de dia COVID sai mga
sanga achim kon hoy sanga achim dakki mangna check kagi jan
nampla kon
hindi ba check kagi de ando COVID
may ki belakat ken ne da obvious nga kon COVID sani jamano
okay. Anthaw belakat mo kita diwan anchini anchini dakrong bewal kita regular exercise kana nanggen dakte biljeme exercise hongja normal exercises walking power walks kana manggen alamalan no steps tonga ande warang ko changini changkatam up down kana manggen not rigorous exercise ndakim na thang chani ngani simsak nanggen hydration maintain kana nanggen atni chi ngani aba chida ka barang ko nga kan ching bangat nang hydration maintain ka na yan tang ko ranat na nang jawa daki mangna fresh fruits fresh vegetables chani ngani simsaki muna tang ko belakat na matgin matgin anga kadonga I mean I hope answers that question.
Sebati sangma ndake singat skainga doktor kasapai yakuba talatian pabo je mandean PCOD sa dongguparang ara ya biji ko COVID vaccine shuna managin ma nasimangi yani gemen ba uyatani ko on pabo metela andene was atinga PCOD donggupa rangba ya vaccine ko ra nagata magenama
manchong mata mamang jajingai dongja mamang jajingagri mamang hindanigri nasimang yangi mangna antang ko shui bana mangen mamang jajingai dongja
Matela doktor ka sengsul di shira nakis ngatinga doctors ya chika ko shunas kang skin test kana gata nangjama maina matam vaccination center ang ode mamung check up ka agri sa dunga dungija ko singanirang ba test ka anirang ko dakja shujolaya Dr. Momen ayana akan sakat kana gata magema Dr. Momen
Matela sengsul di shira yan ang nis nganina J COVID vaccination center na yangentum
Dr. Momeni network namjaya kon Dr. Sangman ayani gemen akan cakat kana magema
yang jika ko shuna gata jing mamu skin test kana gata nangja maina anga da shina kana ha ya ra blungen safe nga aro na ya vaccine shuna skang mamu da kita skin test kana gata nangjawa da shi anga allergic ni gemen ba kana ha haida nang ni jajring anira ya ko skin test ka gita shingen mode allergic na khinning na ba kana ndi mangba angni da shi aga na ha gata mamu jajring na gata nangja aro ba wasan bu da na shi mangkora in 30 minutes na de observation 방남 농락다 나가보면 우리 그러면 야 30 minutes 나서 마몽가 리액션 그 만자겠지 뭐 어디 나서만 자진 나겠다 남자 나오드 피츠가 너같이 노만수원이 그때 나랑 봐 마몽 컴플레인 봐 동자 나 배는 어찌지 겐치 뭐 망봐 warangten dauta naso substitution ba antihistamine nakabara ko sir ni nampala ta manaya ba at the most severe o chiso bang kala ode naso chinga prednisol na ko na ta manna diba ya center ora chara doktorang 동안 nurses 동안 any reaction ba naso kakata be kakata ko 잡아고 뭐 ba yana jajeng na ta nang to doctor sanga yerang ko manage kana ta manaya ini kemen mamu skin test kami kan ayat chika ko na ta manaya
Matela Dr. Sangma nambe thalatanina Shalim Manda Sangma SMS Denis Ngatskanga positive manani gemen isolation machotani jamano RAT test kathaina niyam dongjama nijao angni isolation machote kathaina mora kana jetaka unasa singatanga bian deke singatinga positive ani jamanora government era red test ko nagata order banyam tungjama ni singatinga diba sa katami ko nagata magin
akan sakat na ya daog Meghalaya Sorkari ni gatal guidelines kata de salchikeng quarantine ba isolation macho ta hang ode aro ya salchikeng ni gisep ko wat bon kam gapa salgat tamo malum fever dongja hang ode mamang rangsi sokkinya dongja ode aro saturation ba beno oxygen ni komiani dongja hang ode patient ko test khathena nangja an gapa ko Sorkarian guidelines unjok uni gimen da ode जे mangan salchikeng nami sadap kija isolation machottang hachin warang kore salchikeng jamano anching cure ne chane mangna test ko khathai jajo
Mitela Dr. dawancheng mukti ar marakni singaku kelas kana Caesar na samrengeng parangara COVID-19 na tika shuma mangen ma Dr. Alka na ya fangan sa katudin ng sagin
Mitela Mr. Mukti nani anina Huwe beben dashi akanang gumengta seizure ba mekana chi matri sanya kan mo mat epilepsy ba seizure saga parang wa mangba comorbidities genang pa mandirangon ka aka unigman wa mangba ya vaccine ko na nang chung matan na chung pa grupo kaka unigman anga recommend kagen na semua vaccine ko jirang seizure dong yechim jeng gija antang tangko shui pachina kita mo natin.
Matela Dr. Alka, daw Jojo Sangma Frederick ni sinani ko niyas kana. Cotton mask ganaya ra mamung champing ani dongjawama. Yes, natin cotton mask mamang ko ganwa umay ginama. Dr. Victoria
mamang ko gangi ja kuri thoja anda ko mang cotton mask mang ganna de 30% sun protection offer kaya 30% ba kola 30% sa nak na protection ko nenga aro yako akanon are we willing to take that risk anching mask kangini gani mangna dang tangko 80 to 90% maybe around N95 ka gonna or up to 95% antang protected on na skin ma wa cloth mask ko gani na antang tangko risk ko ngatke so anga na song facts ko sa not na nga cotton mask te kungsa cotton mask na khali 30% protection ko sa not na again ni man kungsa doctors sang de yako recommend kha jawa what do you say Dr. Sangma
Howe, aro wasan bong ja banga changon mask kaning on kochin ko bong china je ko bong china banga changon nos gutuni khamau sa kan to patro aya uni kemen bagi kana kungni protection on gen uni kemen san asunang kotni ko mask kan gen chimo ba it should be fully covered mo namme ke cover khana nanga aro mana de pete dao de cha N95 ko recommend ka ba double mask kana tab mana gen
saksan audience mo kaya ko anak na tenga.
hemoglobin E tunggu parang heart saga parang dasi akan gemen geta comorbidity suka akta rang ba ini kan yam ang vaccine ko na nang aka in ba dasi dokter sama ba akan jok allergy acute ungingo de bawa semoyo nak ni vaccine shu na chanchi metong semoyo ungingo de kasapa yoko nak ni allergy nam kala ona defer kai mengna ba postpone kai mengna ani allergy nam kala o wa getok ni allergy nam negaw allergy nam kala o rana kita mangen मैं दाऊदी vaccine दे गमकचिन freely available ini man ya ko man ruk cho ha dao tal knalo shuruk chaw de ngpa ongja ini man nang ni acute condition bo dao saing pa allergy ko namat chinge mangna nang ni sipang bat ko doctor chi ai mangna wala treatment ra chinge mangna nang ni allergy namang khal joko rana mangen hemoglobin E sana aro heart weak ongpa na de mamang contraindication dongja mamang jajingani ba champingani dongja asong ya vaccine ko jajing gi rana manage dingba dashi doktor sangmani namme thalatang gemen geta allergy acute nginga no de wa ko nasung namat chinge mangna nasimang nama jamano yang na manje anything else Dr. Sangma you'd like to add?
I think that's it. I think
Betul lah, Dr. Alka. Antung buat kamu pa, dalni buat kamu pa, singani ko akan cepang na. Lakswell M Sangma, dikis ngatinga. Kang pa dos ni kam ka anira baita sarangoni kam ka na machinga. Aro baita percent safe and effective. Dr. Sangman ay ako ang natnatamat ba? First dose ni jaman baita na ruta ni jaman ang changara ya vaccine ara ang changa bela kata ni ko nani bias katinga aro baita percent safe aro effective ngani dia winas kinga.
we yes kangpa those could shown nangi antibody develop kana within some weeks at the most 2 weeks abatin nagta mangen nakemna ndiba na second dose ko again tomorrow de nangna bangbata nangna strong immunity ko nagta mangen but the percent is wingas kangpa those covid shield de around 60-70% protection ko nagta manna ndiba when you na second dose ko rao de una nambata protection ko nagta mangen about the safety and effectiveness they are safe and effective when you go ahead you can take your vaccine.
Matela, Dr. Sangma, nambe thalatan na. Senganirang dongpugin chimo ba dal na dong so gumen sumay de yanon ko na ha. Na sumay ko barang sengat nas kugin chimo ode, singa email address ko natin nga wano sengat na gata magyen. Dalo anching na COVID-19 sabi shini gumben. Aro iya sabi shiko tukashwachi champing na manani gumben. Doktorang nambe thalatang ha. Anga bibir iya thalatanirang chi. Nasimang ni dengtang kenanirang aro jajanirang na agan chakaniko manaha. Dalo chanchir mani kita anchang gembakan chika shugen chmode. Aro COVID sabi shina dun soguman niam jekai masko name gengteng kusek aro kutupeko gupe gangen chmode. Aro jakrangko sabonchi name jakshu jungen chmode. Aro saksa sakupunani tangruki dongen chmode. Skango anchang jekai jajinga bri jangi thang bainga chem. Wanda ke da oba school rango thang ani biap rango aro nuk thango maniani rango. Jinma baklan phaina gita maggen. Ya pandemic pas hajinma sako machot ke nanching darang bagan na gita manja. Diba ya sabisina tika rana rute singode ya sabisi patutut kang kugen aro ya virus ba joong ding chang roko mungi na khat tuken. Jika da anching gital roko na gita maninga. Unigaman anching sakan tian COVID-19 ba coronavirus ko champing na dum suguman yam rikirang ko jarik na aro bang sumai ko radam bija chika shuna choko rana ya ko sanangan isuing pa sa kanchina kanat naspa na simangi bakur anina metela. We have come to the end of this program. I thank the panel of doctors for enlightening us and answering to our doubts and confusion. And I also thank the audience for their active participation. Everybody is eager to get back to normalcy, either at work, at school, family gatherings, going to social events. And we have learned from today's discussion that the only plausible and long term solution to the coronavirus is vaccination. We do not know when this pandemic is going to end, but waiting too long to get the vaccine will cause the virus to spread and also give it a chance to mutate and cause many variants like what we are facing now. So take charge of your health by taking the vaccine and continue to follow COVID appropriate behaviors, which consists of 3 Ws: wear mask properly, covering your nose, mouth, and chin. Wash or sanitize your hands regularly and watch your distance and keep at least 6 feet from each other. I thank all the viewers for their participation. Good night to everybody. Thank you. Stay safe and stay healthy. Sakantikon Mitela Aro Wanam.
Jangini rama ng ijakon Namgija sabi siko chachak na ba ng ijakon Chak susrung masko ganerong talantale Jan mauro gijan tang duding tang samsake Ongija koborang kuknajana tika kosuwe haywara chakna Corona jat pasija kangal cha asiata Doa somoy cheyani damsanja kudiya chicken nagri kanal na Kinagri kanal na for better tomorrow for better tomorrow kumongnya talat mo unat mo
National Health Mission, Government of Meghalaya.